Hello. Any questions? Yes. First question with Dr. Louis Pasteur. Hello, no, no, yeah, I'm fine. What about you? Bagunna? Louis Pasteur. Bacteriology. Yeah, that's great. Hmm. Dasari, yeah. How to overcome anxiety? Yeah. Take anxiolytics. Anxiolytics means what? Example, lorazepam, carbamazepine. This go. Okay, it will go. యా చేయాలి కదా. ఎఫ్ఎంజీ క్వాలిఫై అయిన తర్వాత ఖచ్చితంగా ఇంటర్న్‌షిప్ చేయాలి కదా. ధనంజయ దాసరి. సో యాహ్! Overcome anxiety means take anxiolytics. Take clonazepam at night. Clonazepam 5 mg, 10 mg at bedtime. నిద్ర వస్తున్నారు నాయనా. Life after Philippines, it's different రా రే. Different level రా. Literally the life in Philippines and India is very different. Right now, after graduation from the abroad, after coming to India, you know what? There is more responsibility, more stress. We have to stress yourself doing that. So after coming India, you know, after the graduation, coming to India, there is more responsibility. First of all, number one is that we have to qualify the exam. Then you have to do the internship, and then you have to prepare for the PG. Then you have to settle. When we are in Philippines, we don't have this much ideas that we are just enjoying. That's it. But life after graduation is the this is the this is the biggest teaser trailer, biggest trailer in your life. Okay, now after the graduation, life will be very jolly, జాలీగా ఉంటుంది. Okay, now after coming India only we understand the real life. Okay, బ్రో నా సగం రోజు లైవ్ క్యాప్చర్ ఎఫ్ఎంజీ ఫామ్ ఫిల్ చేయడానికి అయిపోయింది. దానికి టిప్స్ ఇవ్వండి బ్రో. అరే సగం రోజు లైవ్ ఇలా క్యాప్చర్ దాంట్లో ఏముందిరా అంతసేపు పట్టదు కదా. మీకేం చెప్పాను మీకు. మీరు మీకు కావాల్సిన డాక్యుమెంట్స్ అన్నీ నేను ఆల్రెడీ టెలిగ్రామ్ గ్రూప్లో చెప్పాను ఏమేమి ఉంచుకోవాలో. ఆ డాక్యుమెంట్స్ అంతా మీరు దగ్గరలో పెట్టుకుంటే ఎంతసేపు చెప్పండి. హాఫ్ అన్ అవర్ కూడా పట్టదు. అంత ఫాస్ట్గా అయిపోతుంది. అది చేయడానికి కూడా టిప్స్ కావాలా. అబ్బా, నా వీడియో ఆల్రెడీ ఉంది, చూసారా ఆల్రెడీ. Clerkship. Yeah. See here, clerkship is like what the main focus you are going to do in the clerkship. Meaning you have to know about the history taking is very important. You have to know history taking. Okay, now you have to focus mainly on the history taking. Okay, now that's it. No need to focus on the how to manage the patient or how to diagnose. These are the work of the PGs and PGs. Okay, for the intern and the clerks, your goal is that you have to know how to take a proper history, how to take a proper history, and by the history itself you have to diagnose the disease. Okay, so lone fighter, so make sure that okay, you know how to take the history. You have to focus on that one. And while you are doing the clerkship in Philippines, it meaning is going to be your final year, and try to study, try to learn the basics from the each and every subjects. Suppose you are posted in suppose you are going to posted in the general medicine, meaning whenever you are going to see the whenever you are in the rounds, or you're going to see the patients, you have to know the diagnosis. Okay, now you have to know the diagnosis. Suppose you are mastering the CKD or AKD patient, or pneumonia patient. Okay, now then you have to take note that, and you have to study a lot. First of all, you have to study about the disease, and then see whatever you are seeing in the wards, what are the diseases you are seeing in the wards. The same questions that they are going to ask in the exam also. because they are because those are the most common diseases. So those diseases are going that only they are going to ask in the exam also. Okay, so every case is very important. At least try to cover 10 to 20% of the subject syllabus. Okay, in every rotation you have to make sure that you are at least you are studying, at least you are gaining some knowledge. Okay, that's how your clerkship should be. Clerkship means you should know how to take a proper history in each subject, and learn about some common diseases. Okay na? And also you have to know about some common drugs and their side effects. That's it about the clerkship. Give some suggestions for okay, మనం ఎఫ్ఎంజి మనం ఎఫ్ఎంజి అప్లికేషన్ ఫామ్లో నా స్టే కూడా చెక్ చేస్తారా అని అన్న ఎక్కడ ఉంది. ఎఫ్ఎంజి అప్లికేషన్ ఫామ్లో మన స్టే కూడా చెక్ చేస్తారా అన్న ఇక్కడ నాకు అర్థం కాలేదురా, ఇంగ్లీష్లో చెప్పవా? Wait. Some suggestion for the, yeah, upcoming December. Yeah, it's January. Da okay. See, medical month. See, huh? Suggestion for the January batch students. I think it's going to be only 60 days left for you guys. I think so, isn't it? So, right now, please study less and revise more. Study less and revise more. Always revise. This is the mantra to pass for the FMG examination, guys. Okay, now whatever you study, please stop that one. Revise. See, every day, morning, afternoon, revise the whatever you studied at 1 to 2 months back, and then you have to at night time, at from the evening to night, you have to solve the MCQs. Okay, now solve the MCQs. Always think why, how. Okay, why and how. Okay, now so that's what you have to do. That's what you have to do that one. You have to always do that one, and try to attend the test and discussion. Try to attend the test and discussion sessions, whatever sources you are using. Please do that one. And please, while attending the test and discussion sessions, guys, uh, you have to observe whether how the doctors are solving the questions, how the doctors are solving the questions, what are the tricks they are using, and what is the key points they are mentioning. Everything you have to look for that one. That's how your preparation should be. Okay, now don't worry. Make sure that first of all, make sure that everything you are revising well, and you are covering all the pyts of the recent initiate and recent neat pg and last 5 years, and you are doing all the mcqs in proper way. That's it. Okay, what you have to do that one. Don't try to read the new topics right now. Okay, next one. Oh, Rani B7. Okay, done. Is internship horrible? No. Who said it's no? No, it's very easy. Timings. See, timings depends on the hospital. For the depends on the hospital. So for the private colleges, it's going to be your 8:30. Okay, 8:30 to 5. Okay, for the private colleges, 8:30 to 5. In some colleges, it's 8:30 to 4 only. Okay, in the and coming to the government college also from 8 to 5 or 8 to 3, 8 to 5 sometimes. Okay, but it's not horrible, Rare. Don't worry. See, the IMGs are also very friendly with us. Don't worry. Now, um, will they check the duration we stayed here in no. No, they won't check. Okay, But actually, no, they won't check actually, okay na. But they will check only whether you are having the 48 months, at least 48 months duration, okay na. 54 months duration total, okay. Okay na. 54 months duration it must be having. So the students who are from the Philippines, please uh, try to mention the date from the your BS date of BS joining to date of graduation. You can mention that one. And others also from China, I think it's going to be 6 years. Okay, but make sure that it must be your 54 months duration. Okay, will I check the duration? Yeah, okay, they will check that one, but they are not going to check that how many months you are staying in India. They are not going to check, but they will check only how many months you are covering. So that your total months should be 54 months duration. Okay. Darkness struggling with Yeah, pharmacology is everyone is struggle rather. But the only thing you have to do is for the pharma is that having always revise system wise. Okay, go with system wise. Okay, na. Suppose example you are studying. Suppose example you are studying the medicine. Studying the medicine, the diabetes. The topic is the diabetes, endocrine diabetes. So in the you have to read like integrating. Okay, na? Integrating with the for pharmacology, okay, so that you will understand. So take one topic, so pharmacology will get up to 20 to 25 marks, okay na. So from the endocrine, this one, the from the endocrine, the anti-diabetic drugs, they're going to from that they're going to be 1 to 2 MCQs. So take a challenge that daily do one topic, okay na? Do one system. So for example, you are starting with the diabetic anti-diabetic medication, so you have to master all the important points about the diabetics, okay, anti-diabetes medications drugs which are okay na. And daily, and also at the same time, at the same time, first of all, what's the medicine, what's the general medicine topic. First of all, you have to know about the disease, for example, okay na. Then only go with the pharmacology, so that it will be easy for you, okay. So it, so always, uh always you have to do revise. This is the only mantra for that pharmacology also, okay. But pharmacology, you have to focus more on the PYTs, okay. Actually, I hate pharmacology during my final year, but right now this is my favorite. This is my favorite subject is my pharmacology, okay. So is that internship same as? No, internship not same as Philippines, Radhe. This is the real internship, okay na? This is the real internship we are going to face in India, okay na? Internship Philippines. See, in Philippines or in any other countries, the internship is no like see, we will get more respect in other countries, okay now. You will get more respect in other countries, okay. Like you will feel the proud moment that yeah, I am a doctor. But in India, guys, interns will not get any respect. We are like a labor for the college. We are everything. We are labor, we are food delivery partner, everything we are. Interns, you know what, right now I'm not feeling that I'm a doctor. I don't have any feeling now currently as an intern. Whenever I go to hospital, okay na, everyone, no respect for us interns. See, internship is like that one. But internship, in the reality, the internship is like this only. You have to face this one, everyone, you have to face this one. But it's okay. See, if you're going to take the internship, so please try to, that's why try to take the internship in government college only, government is going, it will be best for you, in government you will get more respect. But in private college, It's a worst management in private colleges. No respect. No respect in the private colleges. Okay. Next one. Philippines. Okay. In Philippines, extreme stress, right, internet than India both. Yeah, India is more stress wrong. India having more stress. Okay. Okay. One any only duration is 54 months. Like can you academic leaves? Yeah. Academic leaves. Are your course duration must be 54 months. Ra. Okay. Na. It will be. Yeah. You can. It is included only. Okay. Na. Included only. See, actually, this 54 months duration is only applicable. It is only mandatory for the students who took their admission after 2021. It meaning those students who are going to graduate in the 2026, for them only it's going to be the duration must be 54 months duration is for them only. Okay now, for us it's okay, no problem. Okay, for us no problem now, but it is mandatory for the students who are going to gather in the 2026. Okay, as per the new rule, as per the new rule is that the students who took the admission after 21 onwards, they have to must and should have the 54 months duration. పక్కాగా ఉండాలి ఓకేనా. For us no need. Next, do we upcoming people get silenced? No. Array, no, forget about the stipend. We are not going to get any stipend. Okay na. See, FMGs are not getting any stipend, but IMGs and they are getting the stipend. In private colleges they are getting in private colleges you are getting they're getting 5,000, and in government college they're getting 20,000, but FMGs are not. Holidays during, no, there is no more holidays. It's going to be a 365 days working days. Okay now, only Sundays might be in in some colleges. Sundays are also working day until half day, only half day, but in some private colleges there is going to be working day only. Okay now. Next, bro, can you please tell me what names should be mentioned? Yeah, degree, degree certificate. Okay, degree certificate you are mentioned. You're from private. Yeah, I am from private. Actually, I joined private because I want to take my internship to like which is near to my house. So there is private college which is near to my house. So that's why I took that one. You say private is better, but government is better nowadays. Yeah, see, private is better for whom, ra? If you see, if you want to take see in private colleges there is more freedom. Okay, na? In government, you have to you in private questions. Okay. See, in private you will get more time to study for for your need PG preparation. But in private colleges, what happened, you won't get any like you are not you won't get any like respect, you know? You won't get any respect, and no more no more much hospitality for you guys. Okay now, that's right. And less patient experience also in the private, but you will get more time to prepare for the examination. But in government, you will get more experience, you will have the more clinical experience. That's what FMG is needed actually. Okay, personal question, can we manage the industry in private? Nora, we can't. We can't. like you can manage with the management. Okay, you can manage with the hospital management. Okay, na? You can suppose example in the internship counseling, you get any private college. Okay, you get any private college, and you can talk with the management that I don't want to, do this internship, but I will just come and do the attendance. I will go, and how much you need. Just talk them. They will. This is okay, but according to the rule, you have to do that one. But it is only possible when it's a private college. Okay, na, like if you are having more support from the what, politicians. Okay, na, any board members, then only it's possible, or else not possible. Okay, then I'll count up to 10. Okay, next I will go ahead. I will sleep now. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, good night.